Welcome back, everyone. Granger Pain and Spine is dedicated to providing relief from chronic pain.
Dr. Geeta Nagpal, a board-certified anesthesiologist and pain management specialist, is joining us now in this sponsored interview to share treatments that can improve patients' quality of life. Welcome to the show.
Thank you so much.
Before we dive in, tell our viewers specifically what you do.
Well, I mean, in work, I guess, because I do a lot of fun too. But for work, I take care of patients. That's why I went to medical school, because I love to take care of people. I focus on pain, and I do a lot of injections to minimize people's pain and increase their function.
There's nothing worse, though, than chronic pain. What exactly is interventional pain management?
You are right. Pain is one of those things that it's all in perspective. Even if we manage someone's pain from here to here, they're still in pain, and we have to teach people to learn how to live and accept and pivot. For interventional pain management, we are focusing on percutaneous, meaning through the skin techniques to minimize people's pain and increase their function. We try to minimize medications people are on. We also do a multimodal approach, encouraging physical therapy and strengthening, but a lot of injections basically to target the cause of pain and reduce symptoms.
Doctor, what are you hearing? What are some specific pain problems that patients are coming to you with?
Yeah, well, our clinic is called Granger Pain and Spine, so I'll focus on the spine. We do a lot of different pain aspects, but the spine is one very large area that causes pain throughout the world. Low back pain is one of the #1 reasons people go and see their primary care doctor, right? So it's something that costs the American public billions of dollars yearly from lost work and lost function. So specifically, there's interventions like epidural steroid injections. A lot of people have heard of epidurals for labor and delivery. Well, we're not doing those, but we're doing something similar where we can put anti-inflammatory to reduce inflammation and the chemicals that happen when you get disc herniations to keep people active. We also have procedures that avoid steroids because people are worried about that sometimes, or we can't do too much, and so we have things like radiofrequency ablation where we can burn specific nerves to give pain relief.
It can be complicated. It depends on what type of injury and pain that you're having. So when it comes to the treatment of this chronic pain, what are the goals? What is your expectation?
Well, I think my expectation is to give patients very good expectations, because I like to say, I'm a little cheesy and dorky. I say I don't have my magic wand with me. I can't make you necessarily 12 or 13 again, but we have to be able to make you function. Function is my big goal, right, for patients. I want you to be able to take your kids to school. I want a grandparent to be able to pick up their grandchild. I want people to go and have tea with their friends, go to the movies. So it's about being able to do the things that keep us as social human beings and being able to do that more comfortably.
How do you know when your pain is chronic? I think so many of us have thought, that hurt my back. How do I know when I need to come in and see someone about it?
That's a great question. So we kind of put things into 3 different groups. Acute pain, which would be like rolling off here and breaking your ankle. Subacute pain after you've had surgery and it's kind of lasting a little bit. And then chronic pain. Usually we define chronic pain lasting 3 to 6 months. That doesn't mean people can't see a pain specialist before that, because if you're playing volleyball and you herniate a disc and you're having radiating pain, sciatica, you don't have to wait 6 months until you see someone. But we call it chronic pain when it's just not healing on the normal pattern that we would expect.
Well, someone who has dealt with some chronic pain myself, there is hope out there, and I think that's what you are demonstrating and your message out there.
Yes.
That there is hope.
Yes, and I think that's really important for people that are suffering, because sometimes they feel like they're all alone, or that people are judging them, and they need that support. They need to know that we exist in order to help not just them, but a lot of people, and ways to be able to kind of manage that.
Yeah, they're seeing incredible results, everybody, at Granger Medical Clinic. If you'd like more information, you can go to their website. It's right there on your screen, grangermedical.com. Also on social media, and now there's a link on our site at abc4.com/GTU. And our thanks to Granger Pain and Spine for that sponsored interview. Doctor, thank you so much for being on the show. We'll be right back with more after this.